Hello and welcome to another episode of The Crux. This is where we try to look at newsy events, current affairs that are affecting India and the world. And our attempt is to simplify you and get you to the crux of every issue. All over now, you would be seeing that there is news of Mpox, especially since we now have a confirmed case here in India. It is a matter of concern, of course. We've just finished, probably done with the COVID-19 pandemic. And as the years pass, we see that there are more and more viruses, especially zoonotic ones, which are doing the rounds. How do we prepare ourselves? How worried should we be? We will be discussing all that and more about the monkeypox and other viruses today here on this episode of The Crux. We have a very distinguished guest here with us, Dr. Shahid Jameel. He has obtained a PhD in Washington at Washington State University, USA, in biochemistry. He's a very well-known virologist. He was also CEO of the Wellcome Trust DBT India Alliance and founding director of Trivedi School of Biosciences at Ashoka University. He is now a fellow at the Oxford Center for Islamic Studies and at Green Templeton College, University of Oxford, UK. Dr. Jameel, absolute pleasure and honor to have you on The Crux with us. Thank you so much for joining us on The Crux, and absolute pleasure and honor to have you with us, Dr. Jameel.
Thank you, Shatapa. Pleasure to be here.
As I was mentioning, we now have a confirmed case of Mpox here in India, of the variant which is supposed to be more contagious and therefore more worrying. Can you please run us through what are the different strains which are there, and how worried should we be about the current situation?
Right. This virus, which used to be called monkeypox, but the name was changed to Mpox last year, uh, is a virus that has been known since the 1970s, originally shown to be in Africa. The virus is endemic in Central and West Africa. Endemic means that it circulates quite routinely in the population, and at times causes some numbers of infections, disease, and mortality. There are traditionally two different types of Mpox that have circulated historically. Uh, One is called the clade 1 virus, which has circulated largely in the Congo River Basin, with most cases coming from the Democratic Republic of Congo. And another variant, which is called the clade 2 virus, which has historically circulated in West Africa. What has happened now is that two things have happened. One is that the numbers of infections have gone up in Africa. And the second thing that has happened is that the virus has come out of Africa. And in 2022, when WHO declared public health emergency of concern, the virus was found in more than 120 countries around the world. Uh, they had over 100,000 cases reported, confirmed from about 120 countries. So historically, that's what we know about the virus.
Right. So, what we understand now is that this has been there for a while, but obviously there is mutation happening, right? And with the fear that it's traveling out, I think globally we have about three cases, if I'm not mistaken, so far of the more infectious variant, which is the clade one. Same which we have in India itself. Do you foresee Mpox mutating and becoming a problem like which takes on a pandemic role? Can it become something like that?
So the clade 1 has always been there. As I said earlier, clade 1 was endemic in the Congo River Basin. What has happened since 23 is that a new variant has developed, most likely in the Democratic Republic of Congo, in a remote area. And that is a more transmissible variant.
Hmm.
Uh, it simply means that instead of really intimate contact to transmit it that was needed earlier, the virus transmits a little better. And when any virus that transmits a little better at an individual level, at a population level, you start seeing significant effects. So that's what we are seeing. Now,
Right.
as far as mutation goes, if you give the opportunity to any virus to multiply at decent rates, you will start seeing variants coming up. And this simply happens again as a low probability event for every round of virus multiplication. But
Hmm.
again, if the virus multiplies more, you will begin to see it appear at a population level. So that's what we are seeing now. Now, your question whether it can become really a pandemic, I doubt it. And the reason simply is that I can understand the worries. We are just coming off a pandemic, and here comes another virus. So the immediate reaction is, are we going to have another pandemic? But look at the facts. The facts are, and I will. It's easy for me to compare COVID to this so that people can understand it very well. When the COVID virus came about, it was a completely new virus. The global population was completely susceptible to that virus. There was no vaccine, there was no prior exposure to that virus.
Hmm.
Every one of us was susceptible. In this case, that's not the case. There is a vaccine available. Uh, we All of us who were born before 1980 have received the smallpox vaccine. Smallpox was eradicated in the late 70s, early 80s, depending upon which country you're talking about.
Hmm.
And I think 80 or 82 was, the vaccination stopped for smallpox.
Right.
So many of us have received the smallpox vaccine. And, you know, people who were in school in the 70s will remember how we were lined up and given smallpox vaccination on our left arm. And if you have any doubt, look at your left arm and you will see three round marks. That is smallpox vaccination. So many of us have received the vaccine. We have at least partial immunity to it. And when
Hmm.
this partial immunity is there at a population level, the virus cannot really run havoc in a population, just like uh, COVID did. Remember, we were all completely unexposed, unvaccinated. So
Right.
that's one. There, we have received a vaccine for smallpox, which protects against mpox. We have tools that are available today to prevent any large outbreak. We know what the virus is. Unlike COVID, we didn't know what the virus was. So we have tools for testing. So all of that, and we have networks through which we have eradicated smallpox. There's an
Hmm.
immense body of knowledge. So considering all this, and another very important factor is this virus is transmitted through intimate contact.
Right.
If you touch somebody, or I actually rub against somebody who has the infection, if you're sleeping on the same bed that an infected person has slept on, uh, all that causes the infection. It is not a virus that is airborne. It is not a
Right.
virus that you can cough out and infect someone,
Can it ever
unlike
become
the
that?
COVID virus.
Could it ever mutate to become airborne?
It's anybody's guess. We don't know the answer to that. Uh,
Fair enough.
no one can predict whether that will happen or not. Viruses that are airborne are able to sustain their multiplication in our upper respiratory tracts and in our lungs, more in our upper respiratory tract than in our lungs.
Hmm.
So, therefore, we can cough it out from our throat or we can sneeze it out from our nose. Uh, this virus is not known to be multiplying in our upper respiratory tract, or
Hmm.
so not at this time. But what it takes for a virus that largely grows on the skin, in the lower uh, layers of the skin, uh,
Right.
to suddenly become a virus that can infect respiratory tract, we don't know the answer to that. But
Right.
a good guess is that if you allow the virus to run, any virus to run rampant and have uncontrolled access to a population,
Hmm.
it will mutate. Now, in which direction it will mutate, we don't know. That's a completely random chance event.
Right.
So hard to say that.
So, a couple of questions on this. You did mention the smallpox vaccination. Now, I'm born after that, so for example, I don't have a smallpox vaccination. Of course, there is the whole, how the population takes it, and then the whole immunity that sets in. I was
Mhm.
reading somewhere that because this happened long ago, and I believe WHO officially said smallpox has been eradicated in 1980, post which many
Mhm.
of the countries stopped the whole vaccination program. There's been a
Right.
few decades which have passed. Is that effect waning? And if yes, is there a need now to restart vaccination of the younger populations or those who've not received it earlier?
Yeah. So any immunity wanes with time. Uh, and that is why we often get boosters. In with childhood vaccination, we receive repeated doses of the vaccine at different ages till we attain a certain age. Uh, and what that does is to build up our immunity. Now, our immunity is based on two types of things. One is antibodies
Mm,
that circulate in our bloodstream. And if we get infected by a virus, those antibodies, if they are present in the blood, can very quickly neutralize an incoming virus. So that can either prevent infection or it can restrict infection very, very quickly
mm,
because the antibodies are there. But antibodies have a half life, which means that they go away with time unless you give a booster,
mm,
right? And for different pathogens, viruses, bacteria, the antibodies to them decay with different kinetics. So some will decay faster, others will decay slower. So that's the antibody part of the immunity. There is another type of immunity which is called cellular immunity. When we give vaccines or when we get infected by something, some of the immune cells in our body remember that infection.
mm,
So it causes an immune memory. And that's the reason why you vaccinate children repeatedly with childhood vaccines, to create an immune memory against, let's say, whooping cough.
mm,
Uh, and when that child later in life gets infected by that germ, the memory cells get activated and they will restrict the infection. But the memory cells take a little time to grow up in our body and take care of the infection. So if we already have antibodies, it can very quickly restrict. But if we don't have antibodies, we still have immune memory, which takes a
Mm.
little time to restrict the infection, right? So a lot, since smallpox vaccination stopped in 1980, many of us who got the vaccine are unlikely to have any antibodies to smallpox. It's been 40
Mhm.
years.
Yeah.
Uh, but we still will have those memory cells. So if one of us gets infected with monkeypox will infect us, but it will not cause severe disease because it will be controlled by those memory cells that regenerate in response to infection. Now, as for people who have not received any smallpox vaccination, yes, they are the susceptible population. So, unless there is evidence that the virus is really uh, running in a big way in a country or a region, there is need to vaccinate. But otherwise, I don't think it's really needed to just go into a general population and start vaccinating with a smallpox vaccine. A
Unless you're
better,
traveling to
yeah.
Africa.
A better strategy is to deploy the vaccine in regions that are endemic for it.
Right.
Remember, this smallpox vaccine has eradicated smallpox from the world, and it is also effective against Mpox. So, the
Mm.
most effective strategy would be to deploy it to regions where the infection is spreading quickly. If you douse the infection there, then there is no need to vaccinate populations in regions where there is no infection at this point.
Right. Right. Uh, Also, a simplistic question, but something that could be very relevant to a lot of our audiences. Chicken pox, for example. I mean, we've almost all of us have had it, in our childhood. How different is that from Mpox? I mean, is there any uh, immunity memory that kicks in for people who've had chicken pox, for example, or is it nowhere comparable?
They belong to the same family of viruses, but Mpox and smallpox sort of are more closely related
Hmm.
than
Hmm.
chickenpox. So I have not seen anything in the scientific literature on chickenpox protecting against Mpox, but smallpox vaccine certainly protects against Mpox. Yeah, they're the same family of viruses.
Right. You also mentioned that it's very important to control what's happening in those regions where it is of an endemic nature. So we're looking at
Mhm.
some of the African nations. Obviously, this has been happening for a while, which last couple of years, which brings me to the question that um, could we have done more? And when I say we, I mean nations who have the capability. We see US right now stepping in to ramp up their support, and that has come after WHO has announced it as a public health emergency. And the reason behind announcing it is to get developed nations to kind of take cognizance and deploy funds towards it. Do you feel that the action could have started a few years ago so that there was more control over the situation which is unraveling now in Africa?
Absolutely. There's no doubt that if the world had acted earlier, uh, then we would not have seen this situation. Look, I mean, the 22 outbreak. there was a public health emergency called in 22 as well. And if you
Mm,
look at the epidemiology, uh, most cases are actually being reported from the Americas and Europe,
mm,
and not Africa. Now, the reason for that could also be that uh, there were better diagnostic tools and surveillance available in Europe and Americas compared to Africa. So that's another thing. Strengthen the tools and the availability of those tools at locations where a virus or a disease is endemic. In 24, more cases are appearing in Africa. Uh, so certainly countries could have done more
mm,
in really vaccinating populations in Africa. And that unfortunately didn't happen. And it's not just vaccination, it's also testing and surveillance. You know, the the call rate for a suspected case to become a confirmed case is less than 10% in Africa, whereas it is almost 99% in Americas and Europe. Why is that? It is because there are more tools available in the West, there are more experts available in the West, whereas Africa remains an ignored continent. And if we continue with that attitude, more and more such events will happen. And, we will be spending a lot more money fighting these infections once they have escaped from their endemic area. It's far more economical, far more efficient to control it at the source.
right.
I mean, it's like a fire. If a fire happens, you control the fire at the source. You
Right.
don't let the neighborhood burn and then start controlling it in the entire neighborhood.
Absolutely. And also, I mean, this is not the first zoonotic virus. This won't be the last. I mean, the way we read about it and what we understand is with global warming and climate change and the glaciers melting and the ice melting, there is a lot which could be thrust upon us, which is kind of coming back to us. And it's a bit scary. It's a bit scary for the world to expect new and new viruses. How do we prepare ourselves as a nation to be able to counter this? We don't want a repeat of COVID-19, but how do we kind of prepare for not only Mpox but any future virus outbreaks?
Well, Shutapa, you're absolutely right. With global warming, things are going to get worse. And the reason they're going to get worse is uh, that, sometimes vectors for disease transmission, for example, mosquitoes,
Mhm.
can now propagate in cooler climates. So, for example, dengue, which was largely a tropical disease, has now moved into southern US, southern Europe. Why is that? Because the mosquito can survive at the slightly higher temperatures. What will also happen is that people and animals will both start moving towards colder climates. So there will be increased density of humans and animals in slightly cooler climates. And therefore, there will be more opportunity for interaction.
Mhm.
We are also cutting down forests. A lot of animals that never come out of the forest will suddenly have no home and they will be out. So again, there will be more interaction with humans. So all this is going to lead to more viruses jumping from wild animals into humans, new viruses that we have not seen. Now, how do we protect? Well, one, of course, is continued research and understanding of what is out there. So, for example, bats are a very uh, big source of viruses that infect humans.
Yeah.
But we only understand a very small percentage of viruses that reside in bats. So research is important to know what is there and what it takes to control it. But a policy and a strategy that should work very well is to not ignore anything uh, as it starts happening, and continued surveillance. And if something stands out, address it quickly
Hmm.
and use all the tools available to address it. Now, for example, how do you know that something that has come up, an infection that has come up, has already circulated in this area, or is this a new infection? So now imagine a system where you are continuously monitoring uh, a population for infection, and I'm not going to get into details of how you can monitor because that gets fairly technical. But if you have a system of continuous monitoring of, uh, let's say, a group of infections, you establish a baseline. And then in that surveillance, if you suddenly see a spike happening for some infection, you immediately know that, you know, something, something strange is going on. So a longitudinal approach, continuous surveillance is very important. If you do a cross-sectional approach, you will miss it. And you
Hmm.
don't even know when the spike happens. So we are coming to an era where while we do more research and develop more vaccines and develop new tools, it is also very important to deploy existing tools. And we have very good existing tools. Deploy existing tools quite widely. Just to give you an idea about India, for example, during
Hmm.
COVID-19, we saw that uh, surveillance of sewage water can give about a 2 week lead time to predict whether COVID will break out in a region or not. Uh, so you get that 2 weeks to prepare. Let's say the city of Bangalore uh, has shown that a certain COVID variant is spiking in its sewage population, but you still don't see it in the population. You get 2 weeks to prepare for it.
Yeah.
If you can do it for COVID, you can do it for dengue, you can do it for several other infections. So,
Is that
but if you
happening
don't
here in
do,
India? Is that
actually, it
happening
is
here in
happening. Yes, a lot of people. I said Bangalore because Bangalore municipality is doing exactly that. There are some scientists who developed this system and it has now been deployed. They work very closely with Bangalore municipality. Same is happening in Hyderabad. So why shouldn't it happen in Delhi and Bombay and Raipur and Kolkata and Nagpur and Darjeeling and Shimla? Why shouldn't it happen? We have the resources, we have the tools. Why are we not doing it? We should be doing it. Uh, it's
Do you
far
also
more.
Yeah,
Yeah,
do you also feel that enough research is happening at the global level, but more specifically India? Because with us, our population, while it's a blessing, is also our curse, right? It's our biggest burden. If something breaks out, it's always widespread. The chances are much more because we're just
yeah.
so packed like sardines right now. So, do you feel that enough research is going on globally and specifically here in India as well, and action is being taken? Bangalore and Hyderabad are great,
Yeah.
but others?
Well, there is a lot of research happening globally. There is research happening in India as well. In India, I feel there could be more put into this kind of research. And what is equally important is that since we're talking about these zoonotic infections which can jump from animals to humans, It requires a more integrated approach. Where do wild animals live? They live in forests. Forests in India come under the Ministry of Environment and Forests. Domestic animals come under the Ministry of Agriculture, Department of Animal Husbandry.
Mhm. Mhm.
Human diseases, human infections come under the Ministry of Health and Family Planning. Three different ministries look at three different aspects of the problem as it will happen in future. We need a more intersectoral approach. Recently, the government of India has set up something called the One Health approach, and a One Health Institute is being established. Those are good things to do. But I think equally important is to empower your institutions uh, and let them take decisions uh, quickly and locally. If every decision has to be certified by somebody sitting in a ministry in Delhi, it becomes very difficult.
Very
So
slow.
you have a good system, expand it, and very important is to empower institutions and the data that you get, share that data widely with your scientific community
Mhm.
because every good mind does not sit in the government setup. There are many good minds that sit outside government setup as well, and we have many good minds. We should utilize those.
Absolutely. In fact, I mean, I was going to ask you that have we learned from the COVID-19 pandemic? And you already touched upon what, BBMP is doing in Bangalore and what's happening in Hyderabad. Somewhere, if we could get our various government agencies and departments to share the knowledge that they're acquiring, like if they are able to monitor this in two cities, as you said, maybe that push has to come for it to be monitored in various other parts of the country as well, and somewhere it has to be a government push, but of course the private sector has a massive role and opportunity to play here as well.
No, private sector will help, but private sector doesn't make policy. It's
Correct.
government that makes policy. So at the policy level, I think the government has to take action, and some action is happening. More can happen. Uh, Private sector will definitely step in. I mean, this whole business of wastewater surveillance was actually done with a large grant from the Rockefeller Foundation to two institutions in India, or actually a group of institutions in India. But then they were able to develop it, and they were able to scale it up to the municipality level in at least in Bangalore. uh, but government has to now take this and spread it more widely. So that's where government needs to step in. Government also needs to put in the catalytic funds for this. If you expect the private sector to come up with the funds from day one, it won't happen. Private sector is looking for returns, but the government needs to put in those funds to build that infrastructure and then involve the private sector into it.
Right. Since you mentioned BBMP, and I'm here in Bangalore, but we've had 10,000 new dengue cases, which have cropped up. Bombay, for example, I think some of my friends in Bombay and Delhi complain of a mysterious virus which is doing the rounds. I mean, everything in that case is mosquito borne. How long do you think it will take for us to go from monitoring things to actually preventing various outbreaks, even mosquito borne?
Well, I mean, knowledge and data are empowering. But unless you have the data, unless you have the knowledge, what will you protect against? So the first step is really to develop that knowledge and have the available data. How long it will depend on what we are talking about. Are we talking about something for which we have tools available, or are we talking about something that we've never seen earlier? But What science has done and what COVID showed very nicely is that going from an unknown, mysterious disease to actually the sequence of the genetic sequence of the agent responsible for it. It took about a week to do that. And vaccines, which used to take 10 to 15 years to make,
Mm.
it took us less than 12 months to produce a vaccine for COVID. And, when the world wanted to come together and do it, billions and billions of doses of vaccines were manufactured and delivered. I mean, I'm very proud that India delivered more than 2 billion doses of vaccine. Uh,
Absolutely.
we have, but would it have happened if we did not have that manufacturing capability? Now that's where the private sector comes in, but the private sector also wants assurance that what it is producing
Mhm.
will not make it lose money. I mean, they may not make huge amounts of money on this, but at least we should ensure that they also don't lose money on it. So it all depends. I mean, COVID has really been a big eye opener and a big learner, all in bad ways as well as in good ways.
Yeah. Yeah.
And certainly, we have in some areas we've done very well in COVID. And we should learn from that and build up on that.
Absolutely. Learn, build up, and very important, remember, because public memory is so short. In many cases, we just say, "Oh,
Yeah,
it's over," but the fact is that there could be something right around the corner, just like Mpox is there. There could be others. We've had SARS, Ebola, and who knows what is there, and somewhere
yeah.
coming together, working together, and we do see at the international level countries, including our own, talking about a very shared cooperation, knowledge sharing, especially where disease and medicine research is concerned. Um, just coming back to Mpox, and we are coming close to the end of our chat. How prepared do you think India is? We are already, there are these screening centers which are happening. Some isolation wards have been put in place. AIMS has, Safdarjung has. Do you feel we are prepared enough? Is there anything do you think the government should do at this point to, at least at our level, be well prepared?
Well, I mean, having the necessary infrastructure and the facilities is important, but also, I mean, if you have an outbreak, your cases are not going to be coming to AIMS or Safdarjung. Those are likely to be seen in small towns, remote areas earlier. So, how does that information percolate down to the district level will be important. Uh, do doctors in district hospitals know what to look for if they encounter an Mpox case, right? So information has to trickle down and trickle down fairly quickly. Uh, Having said that, as I said earlier, that since tools are available for Mpox, I don't really see it to be a real emergency. And the fact that the virus is still not a virus with a very high transmissibility, unlike any respiratory virus.
Right.
Um, so we just need to make sure that information travels down and we have tools available when we and deploy those tools. Remember, in COVID, we did not have any dearth of oxygen in the country. It was just not at the right place at the right time.
Right time.
So that's what caused, and we learned from it. We learned from it, and we now ensure that every hospital of a certain size has an oxygen producing plant next to it. It
Mhm.
is not dependent on cylinders that are that travel long distances to get there. So these are
Mhm.
the learnings, and we go in steps. These are the learnings. But information dissemination is very important. Uh, STDs are a big problem in India.
Hmm.
We have the tools to control STD. We should do it in a very aggressive way. Remember, diseases like Mpox actually are transmitting through the sexual networks at this point.
Yes.
And if somebody has a STD, it makes it far easier to transmit. So
Correct.
if you're worried about Mpox, don't keep worrying about Mpox, control STDs. Uh, that will reduce, susceptibility very well.
Absolutely, and obviously with this outbreak, we do also see there's marginalization of the LGBTQI community as well. I mean, there's a lot of misinformation which is also
Mhm.
doing the rounds, at least in the African nations. I think you're absolutely right. Information dissemination of both kinds. What are the symptoms to look out for? How do we better prepare our populations and our medical fraternity and infrastructure to be prepared for such outbreaks. Dr. Jameel, thank you so much for your time. Absolute pleasure to have you. And you really simplified something which is not so easy to understand. And I'm sure our audiences have learned a lot about not only Mpox, but also about how we can better prepare ourselves. Thank you so much for your time.
Thank you, Shitapa.
Thank you for joining us for another episode of The Crux. Here are the top takeaways. There is only one so far confirmed Mpox clad 1B case here in India. It is the more infectious variant. By all counts, it does not look like Mpox can become a pandemic like COVID 19. But having said that, there is still a need to monitor, do better surveillance, and have better information dissemination so that the right information is percolating to different parts of the community, including the medical fraternity as well as the common person. Thanks again for joining us. See you next time.